For all of your IT needs, visit OmniPerforms.com. Omni Strategic Technologies, the only IT company that the watchdog trusts.
In a hurry and need to see a doctor? The Woodsdale Health Center and Walk-In Clinic is located across from Little Caesars on National Road. Open 7 to 7 Monday through Friday. Patients can receive primary care, treatment of minor illnesses and injuries, wellness visits and physicals. There's also a lab draw station open from 8 to noon weekdays. A division of Wheeling Hospital, the Woodsdale Health Center is led by family physician Dr. Michael Wilson. Call 304-234-1971. They'll take good care of you.
A serious injury from an accident.
Anything from John yet? Okie dokie. I better get prepared to do something else then.
Coors Brewing Company, Golden, Colorado. With great beer comes great responsibility.
Highland Sports Complex is the coolest destination for sports and entertainment the Ohio Valley has ever seen. Pop in for some open basketball in our field house or reserve some turf time for your next practice or game on our synthetic fields. Online registration is open for development classes and leagues for youth and adults. Highland Sports is also the hottest destination for birthday parties and other events. So come challenge yourself on our play climb and enjoy your favorite virtual reality game in the arcade. No memberships required, so visit highlandsports.com to find your next entertainment experience and get ready to reach new heights.
Hello, everyone. From the Watchdog, I'm Darnell Foster. With a look at your local weather forecast for your Friday. Considerable cloud cover with a rain shower on and off through the day. A high near 45. Overnight low of 34 degrees under mostly cloudy skies. A cloudy Saturday in store with temperatures in the lower 40s. Have yourself a great day, everyone. From the Watchdog, I'm Darnell Foster.
The views and opinions expressed on the following program are not necessarily those of this station or its sponsors.
I'm so excited.
You know what today is?
Of course I do.
It's Friday, or as I like to call it, Friday.
It's Friday. Yay!
Yeah. Today is the last day of the work cycle.
Yay! Now it really is Friday.
Looks like somebody's ready for the weekend.
Ready as I'll ever be.
All right.
Let's get this show on the road.
Showtime.
A fresh take on local, regional, and national news. This is the Watchdog Morning Show with Howard Monroe, brought to you in part by Wheeling Hospital.
Well, what have we been, where have we been, and where are we going this morning on the show? Will the charter school debate return to the legislature in West Virginia this year? Answer seems to be a pretty clear yes. Hoppy Kirchville and I just discussed that a bit in the last segment. If you missed it, it'll be up on podcast later today on our watchdognetwork.com website, and click on the podcast page. In a minute or two, McCabe and I will kick around the local news of the Ohio Valley in our Friday roundtable. In the D.C. Digest, Joe Biden proposing 100 days of mask wearing after he takes office. Republican leaders are still struggling to deal with the Trump legacy, and more really weird testimony from a Giuliani witness yesterday in his efforts to overturn Biden's win and convince people there was massive fraud. The CDC has outlined their basic plan to distribute COVID vaccine, including individual vaccination cards. I share the latest COVID numbers with you. Another monolith appears in California. We've had at least three that I'm aware of, these strange monoliths that show up, one in Utah, one in Romania, now one in California, come out of nowhere. They're just in the middle of the desert, in the middle of empty space. Where do they come from? I believe they come from the aliens. I believe there's an alien invasion coming. I do believe that. And they're going to start connecting to each other soon. More of them will show up. They'll show up all around the world. Then they'll begin to speak to each other. And then they'll call in the mothership. It'll come down, and beings will come out of the mothership. And will say, "Take me to your leader." And people will say, "What are you going to do to the leader?" "We will take the leader with us." Guy's name is Trump. That's the leader. It's Trump. Take him away. All of that we've had so far this morning. Weather-wise, going to be cloudy, light rain showers, daytime high around 45. 30, that hasn't changed much all morning long temperature-wise. 39 at the Wheeling, Ohio County Airport, and an even freezing, like it feels like temperature at the Wheeling, Ohio County Airport. And also here at my home studios in the Elm Grove section of Wheeling, and at the Robinson Auto Group Studios downtown Wheeling in the heart of the Ohio Valley. I have an awful lot of my Christmas shopping. I really have all of my Christmas shopping done for my wife. A couple other things I still need to get. My oldest son is a hard guy to buy things for because he's one of these guys who goes out and gets everything he wants. He wants something, goes and gets it, it's hard to buy him for. But basically, I'm done with most of my shopping. Probably still get a few more things for Teddy because of the way I am. What I did not do this year was buy anything for myself. And I don't normally gift to myself, but normally I will buy 2 or 3 things online or somewhere, and I'll tell my wife, "Here, you can give this to me because I want it." I haven't done much of that at all this year. But it is interesting. A survey says 77% of adults plan to buy themselves more Christmas presents this year than before as a reward for getting through 2020. Hello, self. Thank God you made it. Here's a nice gift for you. The average number of gifts the individual buys for him or herself, Biffy, is 6. Just over half of us are buying gifts to use after the pandemic is over. In other words, they're buying things we can't use right now because they involve getting out and among people and so on. But over half of us are buying gifts to use after the pandemic is over. 60% of the people are buying gifts they can use with other people. 3/4 of the Americans are looking for presents that will lift people's spirits, which I think is sort of what I try and do all the time, especially at Christmas time. 2/3 say the challenges of 2020 have made them more determined to find the perfect gift for someone else. Top things that we're gifting ourselves this year: a nice dinner, clothes, I haven't bought clothes for myself in 20 years. Unless somebody gives it to me as a gift, I haven't bought a new piece of clothing in 20. I don't care. Clothes, a vacation, which I really badly want. Booze. Back in my drinking days, I didn't consider that a gift. That was just today. Today, I'd like some booze. And a day at the spa, which is a pretty big deal, I guess. Let's see. And 43% said they don't normally buy themselves anything. And I don't ever gift myself anything. I will sometimes buy things and tell my wife to give them to me because that way I pick out what I think I know I want and so on. So, little holiday conversation there. Is John with us?
Yes, he is.
Mr. McCabe is here from the newspaper. Good morning, John.
Hey, good morning, Howard. How are you?
Your Christmas shopping done yet?
Some of it. Yeah, some of it's done. I think the bulk of it. I think we have a nice Christmas gift on our website today. With you can go through and look at everyone who got a PPP loan. I don't know if you saw that.
I did see that. Yeah, I didn't check out the interactive, but I did see that.
It's pretty cool. It's nothing. Interactive means that we've got little tab. We were able to map businesses by their address, and so when you click on the tab, it shows you the business and the amount they receive. So again, it's just interesting information. The money was there for people to take, and the government was begging people to take the money to keep people working, and I was really glad more than anything that we were able to get the Kevin Heller, who's the CEO of Ziegenfelders, to talk about. They got the largest award in Ohio County of about $2.8 million, I think it was, $2.7 million. Homer Laughlin, we didn't get a chance; they didn't get back to us, but they got about $5 million. And it's interesting information that is good to take some time and digest as much as anything.
I saw the story, but didn't go into detail. So, did anything jump out at you as either? Well, particularly unusual, for example? Did you look at any business and go, what in the world are they getting that money for?
Well, no. And, it's I think that's what is most interesting is kind of looking through and figuring out what some of the holding companies for some of these businesses are. I'll give you an example. There was so the way the SBA broke it down, you had two massive spreadsheets per state. One was for loans over $150,000 and one for under $150,000. So it's a lot of data. I mean, we had 1,400 businesses from Tyler to Hancock counties that got PPP loans. You think about that's a lot of businesses. So as you look through, there was one in Wheeling that an address that kept popping up with all these different names. It was like Woodsfield stores and Hanover stores and this and that, and they were all an address in North Wheeling. And so when you first see that, it kind of pops out, and you think, what in the world is that? Because there's no doubt there was fraud with this program. So this is not fraud at all, because once you start digging in a little bit, here it's essentially the corporate headquarters for all the area McDonald's. Or all at this one location. And, when you look at that, because, again, one of the businesses was Elm Grove LLC. And you think, Elm Grove LLC, but here, of course, there's an Elm Grove McDonald's. So, when, again, you start looking into the charters of these companies, and, you see the names on there, and you think, oh, okay, that's what that is. So that's what, in my mind, is kind of interesting in a way, because, most of us don't go looking into the holding companies that own area restaurants or franchises. So to me that was kind of interesting to start putting some of those puzzle pieces together. So no, really, I spent most of the day Wednesday kind of going through all these and didn't have anything that really jumped out. But when you go into and look through several other states, and it was interesting to see the number of sole proprietors who would get like $2,000, $3,000, and you wonder what their reasoning was. Are they caregivers at home for parents? Maybe. I mean, again, the rules were really lax in a lot of ways and constantly changing. But I just find it to be, if you like information and data, it's kind of a neat thing to just kind of peruse and and get some information out of, and just learn some things. That's all.
looking over the story here, I do have it in front of me now, of the folks getting at least $2 million or more, as you point out, Homer Laughlin was the number one. They make the Fiesta-ware. They got $4.9 million. Most of the ones getting over $2 million, most of them were clearly businesses, large businesses. There's a physician's practice in Weirton, Ziegenfelder, as you mentioned, Sledco, Team Sled here in Wheeling, Cockruth Roofing, a couple of nonprofit or quasi-non-public entities like Good Shepherd Nursing Home. Diocese of Wheeling Charleston got $2.15 million.
Yeah, Change Inc. up in Weirton is one of those. That's so yeah. It and we I know we had reported the over 150 came out maybe 6 to 8 weeks ago, maybe a little longer back. They released that information because when you do look statewide and it caused a little bit of a ruckus when it first popped up. The two single largest grants in West Virginia were to the Greenbrier, that is owned by our governor, and second went to the Thrasher Group, which was owned by the governor's opponent in the primary election. Woody Thrasher. So it's kind of interesting when you look at that and you think, okay, the Greenbrier got about $9 million, and I think Thrasher got about $8 million. And things like that pop out, and you just kind of shake your head a little bit, and say, well, this is just how things work.
This was money that the businesses would apply for based on direct impact on their business from COVID. For example, efforts to try and keep employees on when they would normally have to lay them off, that kind of thing, right?
Correct. Yes. Yeah. From how the program is set up is basically if you applied, and not everyone did, which is one of the complaints I think that government accountability agencies or organizations are really kind of looking at. But you were supposed to give, supposed to say, okay, John and Howard Inc. We had 52 employees pre-COVID, and they would, the PPP was set up so that it would supplement us so that we could keep 52 employees on the payroll through, we'll say, I can't remember if it was July or through the end of this year. I think it was July, if I remember correctly. And you had to spend that money on payroll. So it really, it was meant so that you kept your employment levels steady.
So theoretically, this is all, and again, as you mentioned, elsewhere at least, there have been a little bit of, I don't know what word I want to use, fraud, or some folks have gotten it, maybe they shouldn't have gotten it, but intent, theoretically, this is money that goes for direct reaction to or loss of money or loss of income or loss of staff or what have you from COVID.
Right. If you remember, and it's kind of hard to remember now because it's been so long ago. In terms of, it's only been 8 months, but, everything essentially shut down except for essential businesses. Restaurants were closed, weren't even doing takeout, if I recall correctly, at the beginning. So, if you hire 20 people at your restaurant, those folks, were either going to go on an unemployment, or if you got a PPP loan, you could continue to pay them through that until things open back up. So that was the intent of it, was just to keep businesses functioning and to I guess lessen the brunt on the unemployment system that might have happened otherwise if we had just had 25% of the nation go on unemployment within a 2-week period.
Exactly. At the state level, we still have a large chunk of the federal CARES money that has not yet been distributed, if I understand correctly. The governor got $1.25 billion, I think.
Yes.
And there's still a significant amount of that has not yet gone out any place. And the deadline for that, now that's not quite the same as this, but the deadline for that money is running up on us quickly.
Yeah. So that, they've used some of it for, they did use some for road projects and some other things. But, I think I'm trying to remember the last story we ran on it that Steve Adams did. But I think a good, the brunt of it has now been spent or at least allocated. And I can't remember exactly what that number was, but yeah, they've got to get, and I'm sure the governor's, not going to let that, or at least I would hope he wouldn't let any of that go to waste, because there are things that could be done. Quite frankly, businesses right now are in dire need of some hope and some stimulus, of something. I mean, this is a really tough time right now. And the first quarter of next year is not looking very good right now. Vaccine or no, because it's going to take some time to get that vaccine to distributed and out into the and then to get people back spending and doing other things. And so I think we're in for I'm going to say it's a slow recovery, but it's going to be a long haul recovery. I think if the vaccine is as effective as all the companies claim it is that are releasing them, we could see a really strong maybe second half of 2021 as things start, as things reopen. But we kind of thought that was going to happen this summer, or at least a lot of people hoped it was going to happen this summer when everything reopened, and then essentially had to start closing or scaling back within a couple months.
Well, but remember, the world will be a better place next year because Joe Biden will be president. So
you got something important to talk about instead of that nonsense.
Yeah, I do think it's interesting on this whole coronavirus thing, though, that we're looking at the glass half empty and half full at the same time. I mean, we are in the midst of probably the worst of this pandemic right now. Across the country, in terms of the total number of people being impacted, the deaths, the hospitals are back being full again, and so on. And that's the half empty part of things. On the other hand, a lot of our effort now a lot of our hope, I guess, is being pinned to the vaccine, which could begin to be distributed as early as the next couple of weeks.
Yeah, it's been pretty interesting. Howard Gamble told us earlier this week could be looking at maybe as early as the 12th or 13th of December, which is next Saturday, the 12th. So just looking at that and getting an idea of, as that rollout begins, and vaccines, this isn't just the U.S. that's going to be looking for this. This is going to be a worldwide push for who gets it. So it's going to be a really interesting to watch how the rollout goes with this. We already know that there'll be healthcare workers. Probably first up, we see what's happening right now in some of our local long-term care facilities with the deaths that are, happening every day. So that probably will be next. And quite frankly, the ones we know who are least susceptible to at least having symptoms and deaths. Right now in West Virginia, there's not been a single death reported under the age of 20, and only I think 2 or 3 deaths between 20 and 30. So we know after 9 months that those are the low risk groups. Pretty much under 50 is pretty low risk for percentage wise in terms of dying. So those will be the groups I'm sure that go through last. What I'll be interested to see, Howard, is as we go through how they handle nursing homes, because again, nursing home residents are not the ones who are bringing the virus into the nursing home. It's coming in from staff. It's coming in previously from visitors. And you look what's going on down in Marshall County. Some of the nursing home down there has really been hit extremely hard.
Was it Mountain View that had 100% of, at one point, it may be different now, but last week or the week before, 100% of their patients had been diagnosed positive, I think?
Pretty much, yeah. It was maybe within a couple people of 100%. And I'm looking actually right now to see they have, it's now called Stone Rise Moundsville, I think. It's no longer Moundsville, it's no longer Mound View. And I'm trying to see if I can find, I'm sorry, I thought I had it on here, but they've had again a big hit down there, and it's led to at least what we believe would be a number of deaths in those facilities. The Cameron, the health or the nursing home out in Cameron also had a big outbreak. So it's again we've seen deaths almost every day for the last week. I was looking on yesterday at the beginning of November. This is just a good way to look at it. At the beginning of November, there were 632 cases reported in Ohio County. 632 total from the start of the pandemic. What are we at now? Close to 1,800, I think.
Yeah, 1,700 plus.
Yeah,
close to 1,800. Yeah.
So in the course of 1 month, we nearly, our cases went up almost threefold.
That's threefold compared to the entire previous whatever number of months those were. So, yeah, that's pretty bad. Ohio and Marshall counties, of course, still both red. We are apparently among the worst in the state, I guess.
Well, I know Ohio County yesterday had the second highest percent positivity in West Virginia. That was as of yesterday morning's map, behind only Wirt County. I think Ohio County's percent positivity was like 11.3%. And the reality is right now, Howard, people aren't getting tested. In other counties that are seeing similar numbers to ours, they're having more people get tested. I think Howard Gamble said the other day we had 400 tests, we'll say on Tuesday, and when you have 40 positive cases that same day, there's a 10% positivity rate. So more, if we want kids back in school, if you want things to happen and you want Ohio County to get out of the red, let alone to get out of orange, people need to get tested. And I think right now, primarily people who are getting tested are the ones who are showing symptoms.
I was talking to someone who was actually working one of the test sites in Ohio County recently, and said that there's very little just mom and dad and little Johnny driving by and getting tested. Almost everybody driving up to these test sites are symptomatic.
Yeah.
So people are getting tested because they believe they have it, but the rest of us aren't. Have you been tested?
No, I have not. I've never got tested.
I haven't either.
I just haven't.
Everybody in the family has been. But they've been tested because they've been exposed one way or another. Fortunately, thank heavens, knock wood, hit my head. All my family members came back negative, including little Teddy had to go tested. He was very proud of himself. Very proud of himself, I went to the doctor and they put something up my nose. Granddaddy, I wanted to cry. But he got tested too. So, but I have not done that. And my wife and I keep saying maybe we should just to be on the safe side kind of thing, go get tested, but have not done that. And I'm probably not being a good citizen because of that.
Yeah.
John, I want to take a break.
Sure.
I want to stick with COVID for a minute, or at least some of the COVID follow-up. Wheeling Hospital is getting full and is warning people to be aware of that, but don't be so afraid not to come in if you have a serious problem.
Mm-hmm.
And the diocese, I think, is doing something interesting.
Mm-hmm. I agree.
Is working with some private universities to help them all improve their ability for remote learning, which is a really smart thing to do.
Yeah, you know what they're doing in Ohio County schools? They're planning to send kids to summer school so they can catch up for things they're not learning now. So that shows you a nice difference in approach between the two systems.
We'll talk more about that coming up next here on the Watchdog Morning Show. But first, we'll check some headlines and a little tiny bit of sports if you want to go betting somewhere. We've got the betting lines for you.
The Metro News Update is brought to you by Thomas Auto Centers, Mall Road, St. Clairsville. Get the best deal at Thomas Auto Centers.
in some capacity. You can't just walk away and sit in a rocking chair. I'm not going to do that.
From the Metro News Anchor Desk, I'm Shauna Johnson.
This is your VSIN Action Update on the Watchdog. This Action Update brought to you by O'Reilly Auto Parts, your professional parts people. Get guaranteed low prices and excellent customer service at O'Reilly Auto Parts. Better parts, better prices every day. Now, here are the latest lines from my guys in the desert.
The Steelers taking on Washington on Monday night, one of two games that evening. The Steelers coming off a win against Baltimore at 11-0, 8.5-point favorite over Washington, who are 4-7. The over-under at Heinz Field is set at 42.5. The over -105, the under -115. Penn State taking on Rutgers in New Jersey on Saturday. The Nittany Lions an 11-point road favorite, -400 on the money line, while the Scarlet Knights are +330, over-under at 52.5. With your VSIN Action Update, I'm Tony Desiri on the Watchdog.
Hello, everyone. From the Watchdog, I'm Darnell Foster. With a look at your local weather forecast for your Friday. Considerable cloud cover with a rain shower on and off through the day. A high near 45. Overnight low of 34 degrees under mostly cloudy skies. A cloudy Saturday in store with temperatures in the lower 40s. Have yourself a great day, everyone. From the Watchdog, I'm Darnell Foster.
Hi, this is Shauna Johnson from Metro News. Join us weekdays on the Watchdog Morning Show with Howard Monroe for the latest regional news from West Virginia and beyond, along with news and weather from WTRF-TV and Bill DeFabio Sports. We give you the Ohio Valley's most comprehensive morning news right here on the Watchdog.
Follow us on Facebook for the latest news, show updates, podcasts, alerts, and live video streams from the Valley's only network dedicated to local, community-driven talk radio, The Watchdog. Give us a call and tell us what you're thinking. Locally, 304-214-1600. Out of the area, toll-free, 866-514-1600 or 304-232-8255.
Here's a look at the Ohio Valley local news week in review with newspaper editor John McCabe and Howard Monroe.
John, a question off the text line. I'll throw it to you. Why is nobody talking about the positive cases at Peterson Rehab or Good Shepherd Nursing Home? I would challenge that nobody's talking about it, but any comment about that?
Yeah, I think I think part of the problem has been we've written on Peterson and some of the deaths that have happened there and the outbreaks they've had there over the last few months, but just in looking right now, because I haven't looked in the last several days, and it's only updated on a weekly basis now. But anyway, as of last Friday, or as of the first, which was I guess Monday, you had one active resident at Continuous Care, 20 active residents at Good Shepherd, and 49 active at Peterson. So it's a fair question. I think part of the narrative that got with Stonerise is Stonerise was very Mound View was very public about their case numbers. They have Ann Ali, who helped run Woody's Thrashers campaign, is doing PR for them now, and spoke on it, and they had on their website, which I now think maybe is gone. Their positives and their residents and positives. So they were just providing more information, making it and again, when you have what was it at one time 89 of 93 or 89 of 91 patients who were positive, that's a little bit different. That's a different level when you've got almost 100%. Of the virus in the facility at one time in every patient. So I'd say that's why, but I mean, there's probably not really a good answer other than that.
Well, I think part of the problem is there's so much information that comes out literally every day, and I try every day to at least put together the total number of cases in each of the local counties, Ohio, Marshall, Belmont County. But by the time you begin to get down into unless you have, as you point out, an outbreak that is significant in the population at a place like there was at Mountain View, where getting pretty close to all the residents were affected.
It's a fair question, though. I mean, it is.
It's just hard to keep up with, and I think we all the numbers we get lost in the numbers sometimes. But it's a fair point.
It is.
But I do think the information's out there.
Yeah, and it's definitely nothing intentional. I mean, it's as you said. There's so many different ways to report on this. And it's just it's a fair point. It's something we'll continue to evaluate and look at, and so thanks for the texter for pointing that out.
I want to go back to the Diocese of Wheeling-Charleston. They're working with some colleges and universities to assess remote learning and come up with some better strategies and so on. Is that the way I understand it?
Yeah, what they're doing. So they're doing that. That's one. And on the second front, they've been working. They essentially had schools throughout the system start signing up this summer with students at Wheeling University and Franciscan for tutoring with students who might be having troubles and who might be falling behind, or again, some kids don't learn well by looking at a screen all day. So they're setting up. They've set up. They're not setting it up. It's been in place throughout the semester, and they're looking to expand it in the spring. But it's an interesting way because it's interesting on a couple fronts. Number one, it helps the kids who maybe need help right now. Number two, it helps the students who are teaching students, many of them, or all of them potentially. It helps them to learn while they're still, it gives them a new track of learning essentially as a student teacher, or in this case, a student tutor, in learning how, remote teaching can best be done. Because again, remote teaching isn't necessarily just standing in your classroom with your laptop open and talking to a webcam. There's more to there. It's more nuanced than that. So it's helping these students who will be coming out of school within the next year or 2 years get maybe a jump start on how education can be delivered, or maybe in instances will be delivered when they're in the workforce. So that's I think from those couple standpoints, it's really a positive and seemingly, at least according to the diocesan education system, effective method that they've been able to employ both for the schools and for the students at the universities.
I think that most schools, public and private, have done a pretty good job of trying their best to ramp up this whole online learning, whether it's remote learning, remote teaching, whether it's the teacher actually holding remote classes or putting up videos and so on. I think they're trying very hard. But I also think there does need to be some assessment done here on what worked, what didn't. How do we move forward on this? We're going to probably find, not to the extent that we have now, of course, but I think we're probably going to find remote learning in one way, manner, shape, or form is going to be a bigger part of the education system as we get out of COVID times.
Yeah, and
so we need to look back and assess it and figure out what worked, what didn't.
And I think you'll see a lot of education doctoral theses on that subject probably in the next number of years, and which will be a good way to start really learning what works, what doesn't, and I think that's where, if you recall, what was this been, maybe 4 months ago, we were talking on a Friday morning like this, and the assistant superintendent in Ohio County called in and assured us that they were on top of it and they would have a much more effective system than they did in the spring. And that just, I feel like I was on a used car lot and being told that this, 1982 Subaru station wagon was actually a 2021 Mercedes sedan. And and that's kind of how it was pitched to us, that hey, look at there were already Ohio County is already talking about makeup time in the summer for kids. There are and they're scaling back some of their learning at Park in terms of at least the live learning that they've been trying, and seem to be not as certain right now, and I'll say seem, and maybe I'm wrong, wouldn't be the first time, but not to be as certain as which direction they're heading as we wrap up this first semester of school.
Well, I think when Rick Jones was talking to us, it's like, as you know, I've been having some health issues, and people say to me, "Are you feeling better?" And my answer is, "Yeah, I am feeling better. I'm not feeling good, but I'm feeling better." And I think the fall semester, if you will, has been better than the spring was. We learned from spring, improved things in the schools in the fall, but there's still a ways to go. We still have a lot, and I guess that was my point earlier, is that there's still a lot of learning. I don't mean by the students, but by educators. Still a lot of learning that needs to be done to make sure we're doing this the right way. I have noticed, for example, it seems to me, if I'm wrong, again, my perception on this is that more individual teachers and schools are now trying to have actual remote classrooms, meaning the teacher is there talking to these students as if they were in school, compared to just sending videos out and say, read the video and take the test. So they're beginning to refine it, and I think that's the best we can expect to have happen. And probably it probably won't be perfect by the time COVID is over and we get back in school. I would imagine we're back in school.
Well, I mean, Howard,
semester, John.
so I would, here's my argument against what you just said. I have a child in college right now. Her classes are mandatory in person, or you fail. It's that simple. I mean, they have just moved to that model. And I have a senior in high school right now who, is the first one to tell me that, sitting in, and he's a very good student, but, in his mind, in a lot of ways, sitting in a class in the way that the high school is doing it is extremely non-productive. And so it's the challenges that you find. What they need to do, in my mind, is just make it mandatory. That provides accountability for the teachers. That provides accountability for the students. And it stops making excuses
You're
that,
talking
well,
about
we've got to
online
give...
learning still?
Yes.
You're talking about making online... Yeah, well, I would agree with you. Yeah, okay.
And it would stop the excuse of, well, not everyone has the same access. That's life. And not everyone in life has the same learning capabilities. Not everyone in life has the same aptitude to learn math or to learn science or to write a good English paper. That's life, And if you are challenged by learning, or if your home environment is challenged, then you work with those students individually through potentially some tutoring. Again, this would be, I'm hoping Ohio County Schools looks at this and maybe talks to West Liberty and Bethany and to see if they're not already doing a tutoring program such as what the Catholic schools are doing. It sounds like a really good idea. But, there's got to be, just like everywhere else in life, Howard, you have accountability, I have accountability, and right now, it seems like there just is a lack of accountability for the students, lack of accountability for staff in some ways, and how they're, there's just not, just say we're doing live online classes. If you're not in class, it's an absence. After 3 absence, it's you go down the line just like you would if they were in person.
And I'm with you on that. I think eventually, well, again, it's my personal perspective, and I've done no studying of this. I think probably the best type of education, if we're going to have to be online somewhere somehow, it is conducting a class online the same way, to a large extent, you would do it in person with the same guidelines. And I will certainly concur with you. The idea that a kid can say, I'm not going to go to the 10 o'clock session today. I think I'd rather have breakfast. You couldn't do that when you're in the room. Why can you do that when you're at home?
Yeah.
I do think it's more than an excuse. It's a reality that we have internet access issues. We have them here in Ohio County, although elsewhere in the state they're really more significant even than that. And that's something that has to be overcome. And again, I think one good thing of the pandemic has been it's kind of pushed forward the whole idea of expanding broadband in the state. And people come up with some creative ideas. They don't all work. The idea of a school bus having a Wi-Fi system that people can go and sit around is not the best idea, or go down to the school parking lot. I mean, those aren't the best ideas, but we're making efforts. I mean, we got to. It's going to be a lot of it's going to be trial and error right now.
Yeah.
Hospitals also being dramatically affected by the COVID. John Wheeling Hospital last week basically came out and announced that they're going to have some. They're filling up fast, so to speak, with their COVID cases.
Yeah, it's really, my understanding, it's really becoming a major concern over there right now. The number of pandemics that are coming in every day that are going on the pandemic unit is just rising every day. And, as I think as we talked last week, but any which way, the hospital recently said they're already at 75% capacity. COVID beds are rising. The governor has already been talking about, potentially having to scale back elective surgeries. And I know I've heard you talk a couple times this week on, if you need a test, it's probably a good idea to find an urgent care, either the one downtown or the, what was the other one you went to? But no, where you got your chest X-ray at the
Wheeling Clinic.
Yeah, Wheeling Clinic, right? Yeah, I'm sorry, on 16th Street. Those are, if you just need a routine X-ray, it's probably better to look at going somewhere else because wait times at the hospital are not good. And the hospital right now is full of really sick people. More so than I'm not going to say more so than normal, but people that I think they're really trying to keep the public out as much as possible right now.
Absolutely. As I said, when I went in to get blood work early in the week, basically they were saying, "Listen, go somewhere else."
Mm-hmm. Yeah.
We're full. Go somewhere else. Try and find one of the other places. John, I got to run. Good talking to you as always.
See you, Howard.
Friend. We'll do it again next week. Thanks. John McKee, managing editor of the local newspaper, with us every Friday on the Roundtable. Bob Westfall is with us almost every day and talks to us about what's happening at the Big Seven. Good morning, Bob.
Morning, Howard. How have you been?
I'm good. It's Friday. I always feel better on Friday than I do on Monday. You know what I'm saying?
Oh, I know what you mean. Yeah, it's been a crazy week.
What are you working on today?
A couple things, kind of a very different type of day. Sat down with Senator Portman from Ohio yesterday. We talked about several things from COVID to COVID stimulus. Thing I think we're going to talk to him use today is he's taking part in a vaccine trial for COVID. I had some very interesting comments from his point of view. So we're gonna have something from him today, just kind of explaining how he's feeling, how things are going, and how important trials like this are to kind of beating this pandemic. So I'm really excited about that interview. That turned out really well. So we'll have something on that with the senator on his COVID trial. So that should be interesting. I kind of like that. Also dealing with COVID, we're also going to do an interview with Rich Lucas at Main Street Bank, talking about their sponsorship of what used to be Symphony on Ice, but it has a new name this year. They're doing it virtually, but as they say, the show will go on. We did talk to the maestro the other day and the artist. So today we're just going to let people know that it's still going on. You can probably sit at your home. I know we're going to broadcast, and it'll also be online. So that's something that's a holiday tradition, and luckily it's been taken away in part in some way, but it's still going to happen in another. So that's something we're really excited about as well.
Symphony's done a really good job of adapting to the COVID world by doing an awful lot of online and virtual concerts and, still reaching out, still performing the best they can.
Right.
There's nothing like a live concert performance. I'm not going to disagree with that, or a live symphony on ice. But they really have worked good. The symphony has, trying to put together outreach programs using the tools available so that people still get their dose of the symphony.
Absolutely. A couple other little things we're working on, a couple maybe a little lighter things. Hancock County Sheriff, No Shave, they're doing a check presentation. Every year there's the No Shave November. Well, anyway, they had a little bit of a competition up there, so there's a check presentation today. Caroline Peters will have that and see who the winner was. I kind of like that. And Trish Flanagan, I'm sure you know her. Probably a lot of people that have been in bad situations know Trish. from her work at the YWCA. She is now with the Victims Advocacy Program here with the Wheeling Police Department. So we sat down with her, just got her thoughts about how important a program like this is. So excited about getting that word out as well. So that's something we're taking a look at today, too.
Yeah, it's part of the changing face of Wheeling's Police Department. In addition to doing sort of traditional law enforcement, Chief Schwartzfeger is really working hard to try to be more involved in things like victims advocate and so on.
Right. So we're really excited about that. And, of course, we'll have the latest from the governor's presser today. I think it's at 1 o'clock today. So we'll have the latest on that, and we'll see where the state's going when it comes to its COVID numbers. Those are some of the bigger, better things we're working on today.
Sounds good, Bob. People can check things out at noon, 5, 6, 10, 11, 5:30, the statewide show. And, of course, always at WTRF.com or the WTRF Facebook page. Have yourself a great weekend, my friend. We'll do it again on Monday.
All right, guys. Thank you. Have a good weekend.
All right, thanks. Keep an eye out on the Big 7 every day for all the news you need. If you can't watch TV7, you can listen to it here on the radio, the 6 o'clock newscast in the morning, the 5 o'clock and 5:30 in the evening, and the 12 o'clock noon news live from the anchor desk of WTRF TV right here on The Watchdog. Well, it's time for me to say sayonara, see ya, bye-bye, farewell. I got to go. I got to get out of here. Kercheval has the calm coming up next, statewide talk line. Coming up after that, of course, the noon news, as I mentioned, Bill DeFabio's variety show today at noon. And then the afternoon drive today, I believe Butch Maxwell is in on the afternoon drive. So stick around for all of that. As for me, good Lord willing, creeks don't rise, bat phone doesn't ring, I don't get impeached, I don't retire, ticker keeps on ticking, and I don't eat too much. And most importantly, that Teddy says, it's okay, you can go back to work on Monday, Granddad. I shall return Monday morning, 7 o'clock. Another go around of the big gig. Are you back with me, Brother Biff?
I'm back Monday, ready to start another week.
We're going to keep on doing it till we get it right.
That could be a long time.
Indeed.
The Watchdog is FM 98.1, AM 1600 WKKX Wheeling, FM 97.7, AM 1370 WVLY Moundsville.
The ABC News is brought to you by Thomas Auto Centers, Mall Road, St. Clairsville. Get the best deal at Thomas Auto Centers.
Hacker, 2,700.
Yeah, it wasn't the best show ever, but we got through. We got her done. It's we made it through to 10 without too much trouble. I don't think anybody got fired, and nobody passed out. So I guess that's good. I will. Yeah, exactly. I'll send you a promo here in a minute for the weekend. Got a lot of little guests next week. I did it purposely. I got a lot of Radio Rows next week, these 10-minute gift guide kind of things. So we got a busy week next week. And guess that's it. If you need me for anything, you know where to reach me. I'll be around. All right. Have yourself a great weekend, Biff. All right. Talk to you later. Bye.
Office, he says he'll ask all Americans to wear a face covering for 100 days. The latest proposed coronavirus relief bill would bring $300 a week in federal unemployment benefits, $160 billion in aid to states, and no stimulus checks. It's a $900 billion plan getting bipartisan support on Capitol Hill.
Democratic leadership telling ABC News that there's a mutual understanding that the goal is to have a spending bill done by the end of the weekend and pass it either Wednesday or Thursday of next week.
ABC's Alex Perche in Washington. President-elect Joe Biden asking Dr. Anthony Fauci to stay on as a top medical advisor. And back to California, bone-dry brush and heavy winds fueling dangerous wildfires, including the bonfire in Orange County, triggering thousands of evacuations amid the pandemic. Veterans like Orange County Fire Chief Brian Fennessy saying there's no end in sight.
Flat out scary. I have never seen it this